Deputy Chief Minister Manish Sisodia said that there is no community spread of coronavirus in Delhi according to central officials, even though his cabinet colleague Delhi Health Minister Satyendar Jain said that half the cases in the capital cannot be traced to any source. So what is community transmission? According to the World Health Organization, community transmission is evidenced by the inability to relate confirmed cases through chains of transmission for a large number of cases, or by increasing positive tests through sentinel samples. In simpler words, community transmission or spread is said to be taking place when the source of the contagion is not known. That is, when one is unable to trace an infection back to a carrier who has traveled in an affected area or through contact with a person who has the disease. A state of community spread implies that the virus is now circulating in the community and can infect people with no history of contact with affected people and areas. At this stage, it is theoretically possible for everyone to catch the infection. Has this stage arrived in India? The Ministry of Health and Family Welfare has denied that India is in a community transmission stage of COVID-19 and said that the country is witnessing local transmission, clusters and large outbreaks in some places. But a lot of experts have disagreed with this point for months and said that community transmission of coronavirus is already taking place but is not getting detected because India is not testing enough people. Does India have a strategy to manage community transmission? India has a containment plan for large outbreaks that outlines the actions to be taken in case there is a large outbreak of the infection. However, this plan does not specify strategies to tackle community transmission. As per the containment plan, a geographic quarantine strategy and cluster containment strategy have to kick in. This means strict restrictions of movement in a well-demarcated geographical area, house-to-house detection, quick quarantine, isolation and enhancement of surveillance through proactive testing. COVID-19 is an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. The best way to prevent and slow down transmission is be well informed about the COVID-19 virus, the disease it causes, and how it spreads. Protect yourself and others from infection by washing your hands or using an alcohol-based rub frequently and not touching your face.